Welcome back. Well, many MS patients say it's the breakthrough they've been waiting for, the so-called liberation treatment, a procedure made famous by Italian Dr. Paolo Zamboni. It offers hope to millions of MS sufferers around the world. But today, here in Canada, some of that hope was dashed. The federal government announced it will not fund clinical trials.
Based on the current evidence, we cannot further risk the health of MS patients by putting them through clinical trials that would involve the use of those procedures. And so I accept the expert group's recommendation that we wait to see what we learn.
Alkenbrack's announcement comes a day after a panel of experts commissioned by the health minister decided not to recommend clinical trials. Despite anecdotal evidence, Zamboni's treatment is still scientifically unproven. He believes MS is caused by blockages in the veins of the neck and can be treated by inflating small balloons or inserting stents to open up the veins. Back in April, Mark Kelly spoke with Dr. Paolo Zamboni, and he stood by his procedure and expressed regret that Canadians were being forced to travel abroad to get it.
I am also sure that the great proportion of people who will undergo to this treatment, I don't know exactly the proportion, but certainly will have an improvement in quality of life. In a great proportion of patients, we have a long-lasting remission of the disease. In my personal opinion, I am an Italian, I am not a Canadian, but I think that government could offer the treatment instead of hope, travel. Mm-hmm. And this is really a duty of the government.
Canada has one of the highest rates of MS in the world. 55,000 to 75,000 people live with the disease, and Christopher Alkenbrack is one of them. Diagnosed when he was 24, MS slowly took its toll. Eventually, Alkenbrack had to use 2 canes to walk. He suffered constant fatigue and bouts of vision loss. But after hearing about a new MS treatment, Alkenbrack decided to find out if he was eligible. He was, so he cashed in his RRSPs and flew to Poland, where he had the so-called liberation treatment. That was just over 3 months ago. Christopher Alkenbrack is now back home in Canada, and he joins us tonight from Halifax. Thanks for joining us.
Hi, Erica.
I'm wondering what you thought when you heard today that the federal government isn't going to fund clinical trials of this treatment you just had.
Well, I had several reactions, actually. At first, I was frustrated. I was actually a little bit enraged. I was disappointed. But honestly, it didn't come as a surprise to me that they did not approve the clinical trials going forth.
Why weren't you surprised by that decision?
Well, I believe that the MS Society just has another agenda that they're not being totally honest about. First of all, why would I put my trust in neurologists and neurological specialists to deal with a venous condition? The only thing that we know about MS, and we've known forever, is that we don't really know the origin of the disease. So we have a committee that studied and made propositions to the federal government for treatment for Canadians based on something that they didn't really know. And we now have something a little bit more concrete. And, yeah, you know, they've always suspected a venous condition, a venous link in MS over the years.
And yet, scientists on this committee and elsewhere say that there's an overwhelming lack of scientific evidence about this treatment. So I'm wondering why you decided to take the risk, to do this, to cash out your RRSPs, you know, despite all odds for an unproven treatment.
Sure. Well, first of all, it wasn't just my decision. It was a family decision. I discussed it with my wife and my children. And I had a secondary progressive form of the disease. Therefore, there are no medical treatments for secondary progressive, for the disease-modifying drugs. So I was taking drugs for symptom management, of course, but there was nothing left for me for treatment available, and basically it was a pretty grim future that I had ahead of me. So I really felt that I had nothing to lose and everything to gain. And my initial goal in seeking the treatment was to stop the progression of the disease. And I figured any improvement that I have, if after I've stopped the progression of the disease, if that's possible, any improvement was just, the cherry on top of the cake.
And so has there been some improvement? Tell us what's happened in the 3 months since this treatment.
Oh, it's amazing. First of all, 30 minutes after the procedure, I'm moving freely the toes on my right foot that I hadn't moved for over 2 years. I'm doing physiotherapy as well, and I've regained a lot of function in my right calf. About 3 years ago, I did a 1 kilometer walk with my daughter to raise money for the Relay for Life for cancer research, and it took me about 1 hour and 25 minutes to do the walk. And it was exhausting. I went home and rested for 3 days after that 1 kilometer walk. Now I can walk easily 2 kilometers a day, effortlessly, and continue on and do my activities. I have no more heat intolerance. The brain fog is gone. My ability to stay awake in the evenings is gone. It's 9:30 here in Halifax, and normally I would have been in bed for quite some time now. I can stay awake. I'm enjoying my life. I went horseback riding with my daughter 2 weeks ago, something that I never thought possible before this treatment.
Well, it sounds just amazing, and we're glad you're feeling so much better. Thanks for joining us.
Thank you very much. Yeah, thank you.
Christopher
My pleasure.
Alkenbrack in Nova Scotia. Now, the federal government is waiting for the evidence to come in, but that could take years. So how do we balance the needs of patients against the potential dangers of new treatments? My next guest is a world-renowned lecturer in bioethics. Kerry Bowen joins me now. Thank you for joining us.
Happy to be here.
So what do you think of the government's decision not to fund this controversial therapy?
Well, I too am not that surprised, and I'll tell you why I'm not surprised. I work in hospitals, and I know how scientific rigor works, and I really did see this coming, because I must say this does not meet the criteria of scientific rigor before you move forward. I'm not saying that closes it, and I'm not saying therefore there's not a problem here, but it really doesn't, and that is why this is not being funded at this point.
And do you think it should be funded? Because some folks say it's a bit of a slippery slope if you give voice to the people most affected by this, sufferers of MS, and let them influence what should be clinically tried or not, that it's not science then that's affecting where we spend our tax dollars.
Yeah, and you could lose control of the, how the healthcare system works and research priorities. What I absolutely do think, without question, is there has to be a much more democratic process to how medical research is chosen and funded.
How so?
Well, it's a public system. It's paid for by the public, and I do think we have to develop ways and models where we can have stronger public input into how people see the priorities. Because the priorities now are very much based on science, and they do very much look at disease burden, impact, what situations are the most serious. But medicine is also political. There's no question about that. And to pretend it's not, and to pretend medicine's completely neutral and above all political influences, is absolutely false. So, knowing and acknowledging that, and knowing that this system exists for the public and is funded by the public, I do think we have to have ways to have more public input put into this.
What do you say to critics who say that there are scant research dollars, and so that the research that is done should go for where there's the greatest good possible, not for interest groups, not for those who are most vocal?
Greatest good is a very subjective category, and the greatest good is very different depending on who you ask. So that's a hard thing to actually say. I mean, when we listen to people, and Christopher, your previous guest, is not alone. I mean, what he's really saying is, you know, his quality of life is enormously better. I do think these voices have to be listened to, and I do think we have to find a way to move forward. I myself am fairly caught, because I also know, I mean, this was, you know, the original study was not a blinded study. There was research criteria that just weren't there.
It was small, it wasn't long-term.
No, it was small, it wasn't long-term, it wasn't blinded. I mean, this is not evidence-based medicine, and I know enough from the environments I've been in for a long time to know how this works, and I appreciate it. But having said that, I still think there must be some form of negotiated approach here, because people have a fundamental right. There may absolutely be risks with this, you know, without question. You know, but can a gentleman like Christopher make an informed decision? I would argue he could, absolutely.
All right. Well, Kerry Bowen, thanks so much for this. Good to talk to you.
You're very welcome. All the best.
Well, the MS Society's official stance on liberation therapy is that it's too risky and it requires more research. In June, the MS Society and its U.S. counterpart awarded $2.4 million in research grants to diagnostic studies. The studies will test whether Zamboni's theory is correct by checking for abnormal blood flow in the veins in people with MS and those without. The research projects are expected to take 2 years, and if a clear link is found between occluded veins and MS, the MS Society will recommend clinical trials be started quickly.